So diarrhea is loose stool. ठीक है जी, stool of liquid consistency, increase in frequency, that is diarrhea, right babu? So before we start with diarrhea, something about the GI tract. So this is a cross section of GI tract. So you can see there is inner mucosal layer. What type of epithelial cell? Inner mucosal layer. From your knowledge of histology. No. Okay, leave it. So you can see there are two plexuses, nerve plexuses. There is this Meissner plexus and Auerbach plexus. So in addition to the nervous system, innervation from the central nervous system, gut has its own nervous system. From your knowledge of physiology. So gut has its own nervous system, enteric nervous system. So even if, what is the nerve supply, what is the parasympathetic and sympathetic nerve supply of GI tract? Anyone? No one. Alright. So even if the gut wall is denervated, it will still continue to function because it has its own nervous system. So parasympathetic nervous system coming from the vagus and from the sacral plexus. দরজাটা বন্ধ করে দিয়ে। And also there is this sympathetic nervous system. So this is a picture from your KD Tripathi regarding the peristalsis. What do you mean by peristalsis? Anyone? Huh? Jore? GI? Anyone? Movement of GI. So, naam ki? Huh? Nilanjan. So what Nilanjan has said is somewhat right. It is the movement of the GI tract. So how does that movement happens? So whenever there is something in the lumen, the enterochromaffin cells are stimulated. So they secrete neurotransmitter. 5-HT. That leads to stimulation of the interneuron. So there are two types of interneuron. One is the excitatory interneuron, another is the inhibitory interneuron. So this is the excitatory interneuron which secrete acetylcholine, and that leads to contraction of tooth muscle. Clear? There is also inhibitory interneuron. Alright. So inhibitory interneuron secretes non-adrenergic, non-cholinergic substance, chiefly nitric oxide. So that leads to relaxation of the of the smooth muscle. Basically, this NO that is secreted, it inhibits this myenteric motor neuron. So what happens? It fails to discharge at this point. Alright, so there is relaxation of the segment. So this picture is slightly condensed. So this is the interneuron. So this is being stimulated. So what happens? It excites the excitatory interneuron, which leads to contraction of this segment, and it releases inhibitory interneuron, which leads to relaxation of this segment. So one segment is constricted, another is relaxed. So that is how propulsion of food take place within the GI tract. One segment is constricted, the adjoining segment is relaxed. So that is how propulsion of food bolus take place in the GI tract. Now why is it significant for diarrhea? Now the in diarrhea there is excess of water in the stool. So the in the GI tract water is absorbed throughout the GI tract. Now চলে এখানে বস এখানে water is absorbed throughout the GI tract. Now this rate of absorption depends upon the transient time. The more the food bolus remains in the GI tract, more it will be absorbed. I mean the water will be absorbed. Let's say the transient time is increased. Name of prokinetic drug. Metoclopramide. So what will happen to absorption? Decrease. So what will be the side effect? Diarrhea. ঠিক আছে? And similarly, if there is decrease in this peristalsis, there will be constipation. More and more water will be absorbed by the body. Another factor that determines the amount of water in the stool is secretion. There is also secretion in the GI tract. So if there is let's suppose a person is suffering from lactose intolerance. What is lactose intolerance? Evolve. What is lactose intolerance? Why? So what what he has said, Pritam has said is right. There is deficiency of lactase enzyme. So when a person consumes milks, it is not broken down into the body. So that milk is acted upon by various bacteria, and that leads to increase in osmolarity of the content in the gut. That leads to secretion of more and more fluid into the gut. That leads to diarrhea. ঠিক আছে? So other than this nervous system, there are certain gut bacteria. These are commensal gut bacteria. So why are they there? কি করে কাজ কি? Anyone? Not exactly digestion. So they synthesize certain vitamins like vitamin K are synthesized by these gut bacteria, and also they break down certain long chain fatty acid into short chain fatty acid, the butyric acid. Butyric acid is the food for the epithelial layer of the GI tract. Okay, and most important part is the gut bacteria prevents growth of pathogenic bacteria in the gut. Okay, so let's say the gut bacteria are dead. You are giving excess of antibiotics. The gut bacteria have died. What will happen? What will happen? Huh? আর ওগুলো পরে হয় immediately. So there will be a growth of pathological bacteria. Diarrhea হবে, ঠিক আছে? So there is pseudomembranous enterocoliticus. Have you heard this term? কি? Clostridium difficile. Clostridium, this is caused by Clostridium difficile. Why it is caused? Because the due to excess use of antibiotic, all the commensal gut bacteria are killed. That leads to growth of Clostridium difficile. That leads to pseudomembranous enterocoliticus. Treatment কি? Treatment? অ্যান্টিবায়োটিক তো জানি, তো তারপরে হোয়াট অ্যান্টিবায়োটিক? যা খুশি তাই দিয়ে দিলে হবে? হোয়াট কাইন্ড অফ metronidazole? Why? Correct. So what kind of organism is Clostridium? Anaerobic organism. ঠিক আছে? Metronidazole acts on anaerobic organism. ঠিক আছে? So there are certain substances that stimulates peristalsis, while there are other substances that inhibits peristalsis. So what you see first, acetylcholine, cholecystokinin. What is cholecystokinin? CC কে তো ছোট করে বলে দিই হয়ে গেল। No, this is not contraction gut. ঠিক আছে? GI, don't call it enzyme, it is hormone. ঠিক আছে? মোটিলিন নাম শুনেছিস? মোটিলিটি বাড়ায়। ঠিক আছে? prostaglandin, serotonin. Alright, there are certain inhibitory substances. Just now we have seen nitric acid inhibits contraction. Alright, then there is somatostatin. What is somatostatin? আর কিছু বল? inhibit gastric. What he is telling is relevant for GI purpose. So somatostatin inhibits release of all other hormone. Alright, inhibits release of all other hormone. Then there is opioids. So from our discussion earlier, it reduces motility that leads to constipation. ঠিক আছে? এটা কোন ব্যাচ? বি না? বি না সি? এটা কোন? বি না সি? বি. So the same thing. So innervation, parasympathetic innervation come from vagal and sacral parasympathetic stimulation and sympathetic stimulation. So let's know about something about the fluid absorption. So plasma osmolarity is about 275 to 290. So which will be more beneficial for absorption? Which fluid will be more beneficial for absorption? If you are taking a fluid, which fluid will be more beneficial for absorption? Low plasmolarity than plasma or high? Low. Right, anything lower than this, it will be easier for the body to absorb from the gut. So 9 liters of fluid is taken by the body on an average. 0.2 liter is excreted in normal person. Alright, 1 liter enters the colon. So colon is the region from where fluid is absorbed. Alright, that acts as a capacitance. Alright, suppose there is dehydration. What will happen? Body will try to reserve fluid. So that absorption of fluid from the GI tree will take place in colon. ঠিক আছে? So colon acts as large capacitance and functional reserve and may recover 4 times its volume. So let's suppose the situation there is a carcinoma in colon and the colon need to be resected. Suppose there is a hemicolectomy. So what will happen? সেটা কি? malabsorption হয়, there will be diarrhea. ঠিক আছে? So this is the normal anatomy. Suppose a part of it is resected out, there will be high chance of diarrhea because the bowel gets shorter, absorption gets passage of abnormally liquid or unformed stool at an increased frequency. So there are classification of acute diarrhea, persistent diarrhea, chronic diarrhea. Alright. So in our class we are mostly concerned with acute diarrhea. So why is acute diarrhea important? It is one of the major cause of infant mortality. So acute diarrhea mostly due to infectious agent. So name some infectious agent causing diarrhea. E. coli, and anything? Clostridium, Campylobacter, anything? Shigella, and anything? Staph aureus, food poisoning, Alright. There is Entamoeba histolytica. ঠিক আছে? And organism of historical importance, cholera. শুনেছিস? So Bengal is a place where cholera was endemic at one point of time. Antibiotics. The antibiotics কি করে করছে? How antibiotics are causing diarrhea? Iatrogenic. HIV or immunodeficiency. HIV causes both chronic and acute diarrhea. Okay. So you are having food. So not all food are absolutely sterilized. You can't sterilize food. You are having something or other. So your GI tract are programmed to handle such infection. There is HCl, there is immunity which handles infection. Not all the bacteria that goes inside you can cause diarrhea. Alright. But in case of HIV or immunosuppressed person, they have to take care. ADR. So name some medicine that causing diarrhea as ADR. এইমাত্র তো বললি, প্রোকাইনেটিক ড্রাগ, প্রোকাইনেটিক ড্রাগ এইমাত্র তো বললি। So infectious agent, like I said, Staph aureus causing food poisoning. So enterotoxin, Vibrio cholera. So let's see a little bit about Vibrio cholera. So this is the mechanism of diarrhea by cholera. So cholera produce this toxin. Alright. This toxin has a receptor on the epithelial cell that leads to activation of acetyl cyclase. ঠিক আছে? That leads to increased formation of cyclic AMP. Now this cyclic AMP, increased formation of cyclic AMP leads to secretion of chloride. Along with chloride, sodium is also secreted out into the lumen, and wherever sodium moves, water moves with it. Yes, this is the how cholera causes diarrhea. So chronic diarrhea, what are they called? Secretory diarrhea. So have you heard of gastric tumors? Ki bol. VIPoma, gastrinoma. All right. So all these tumors, carcinoid tumor, all these tumors secretes hormone that leads to increased secretion in the GI tract. Then osmotic diarrhea. So lactose intolerance is an example of osmotic diarrhea, where there is increased osmolarity in the GI content that leads to increased secretion of water. Then inflammatory cause. There is something known as inflammatory bowel syndrome. Have you heard it? IBS. ঠিক আছে? Inflammation. What are the characteristic feature of inflammation? They are always basic feature গুলো বল না. There will be increased exudate formation. Exudate transudate পড়িস নি? তাহলে বলতে ওর কি হয়েছে? তোর কি হয়েছে? কিছু হয়নি, আজ চুপচাপ হয়ে রয়েছে। কোনোদিন খুব ভালো আনসার করে, আজ একেবারে চুপচাপ হয়ে রয়েছে। Dysmotility, increasing motility of GI tract. ঠিক আছে? Steatorrhea. What is steatorrhea? Fat. Why there will be fat? Maybe due to some pancreatic problem. Gallstone or pancreatitis or anything related to pancreas. There is decreased production of lipase that leads to increasing fat in the GIT that increases the osmolarity, that leads to increased secretion of water and diarrhea. ঠিক আছে? Iatrogenic cause. Iatrogenic means it is caused by medication or by some medical intervention. ঠিক আছে? এইমাত্র বললো motility drug that leads to diarrhea. ঠিক আছে? A factitious, a fake case. Alright. Classification of dehydration. পড়েছিস? Community medicine, pediatrics কোথাও? No. So this classification of dehydration. Whenever there is loss of fluid, there will be dehydration of the body. So we classified it into three parts: no dehydration, some dehydration, severe dehydration. Alright. First, appearance. Appearance in no dehydration, the patient will be well and alert. Some dehydration, the patient will be restless. And severe dehydration, lethargic or unconscious. Then, second parameter, eyes. In some dehydration, in no dehydration, they will be normal. In some dehydration, they will be sunken. And severe dehydration, very much sunken. ঠিক আছে? Thirst. Now whenever there is this dehydration of the body, your osmolarity centers in the brain get activated. What is this? There is this thirst center in the brain which gets activated. You feel more and more thirsty. ঠিক আছে? তাহলে কি হবে? No dehydration, drinks normally. Some dehydration, thirsty. ঠিক আছে? Severe dehydration, drinks poorly. May not be conscious at all. So drinks poorly. The skin pinch. When you pinch the skin, it returns to its normal shape. What makes it return to its normal shape? It's the turgidity of the skin that returns to its normal shape. The turgidity depends on amount of water in the skin. That is the hydration of your skin. So when there is dehydration, more and more dehydration, the turgidity will be less. So in no dehydration, goes back quickly. In some dehydration, goes back slowly. And in severe dehydration, very slowly. ঠিক আছে? It's mostly used to classify in children's treatment. ঠিক আছে? So we are classifying this for treatment purpose. So how can we treat the patient? So principles. So there is diarrhea. What are the strategies we are going to apply? ঠিক আছে? First and foremost, there is loss of fluid and electrolyte from the body. So first thing, we have to replenish the fluid and electrolyte. Whatever is lost, we need to replenish it from outside. It can be oral or IV, intravenous, whichever is required. So where oral can be given, some dehydration. ঠিক আছে? And where IV is required, severe dehydration. Patient may be unconscious. Alright, maybe lethargy, may not be able to drink. In that case, we have to give it IV. ঠিক আছে? Prevention and treatment of acidosis and shock. So why there will be acidosis? Now intestinal fluid are rich in bicarbonates. When there is diarrhea, there will be loss of this bicarbonates leading to acidosis. ঠিক আছে? And what do you mean by shock? Romi. What do you mean by shock? Anyone? Poor tissue perfusion. ঠিক আছে? What he has said is somewhat okay. Anything that leads to poor tissue perfusion. Plasma, এখানে plasma volume hypovolemia হয়ে যাচ্ছে, poor tissue perfusion. There may be cardiogenic shock due to failure of heart to pump, or there may be some infection, nutrition কম হতে পারে। ঠিক আছে? Maintenance of nutrition, mainly for the babies. ঠিক আছে? Drug therapy if needed. So in children, one of the commonest cause of diarrhea is rotavirus. Okay, so rotavirus, antibiotic therapy to rotavirus is not required. কি দেওয়া হয় রোটাভাইরাসের জন্য? কি দেওয়া হয়? There is vaccine. আছে তো? So you can vaccinate the baby to prevent infection of rotavirus. তার নাম কি? ফাইড। আচ্ছা, then non-pharmacological measure. So safe drinking water, proper sanitation, cleaning of hands. Alright, these are personal hygiene and non-pharmacological measure that helps to prevent diarrhea. Treatment like we have said, তো তোর নামটা কি যেন? নীলাচল, নীলাক্সো, আর তুই হচ্ছিস নীলাদ্রি, নীলাঞ্জন, আচ্ছা ঠিক আছে, ব্লু অ্যান্ড ব্লু এভরিওয়ে, ঠিক আছে. So like Nilaksho has said, we can give oral or IV therapy, ঠিক আছে, depending on condition of patient. So IV rehydration, where dehydration is severe, ঠিক আছে. What is the measurement? Fluid loss is more than 10% of body weight. So in that case, you need to replenish the fluid and electrolyte immediately. One of the main IV fluid used is ringal lactate. So ringal lactate has this lactate in it. Why is lactate significant? What is the significance of this lactate? No. So this lactate breaks down into carbonic acid. Okay, better to say bicarbonate. ঠিক আছে, so it replenishes bicarbonate loss. ঠিক আছে, you need to correct the loss of body fluid as soon as possible. Within 2 to 4 hours, you have to correct the loss of body fluid. ঠিক আছে, by mostly done by ringal lactate. And the other indication of IV dehydration, weakness, the person is unconscious or there is vomiting. Vomiting হলে কি হবে, যা খাচ্ছে বেরিয়ে যাচ্ছে. So there is no use in oral therapy. So ORS. Now this formula of the formula of ORS often comes in your practical examination. ঠিক আছে, new WHO, the new formula that is important. All right. So sodium chloride 2.6 gram, potassium chloride 1.5 gram, sodium citrate 2.9 gram, glucose 13.5 gram, mixed in 1 liter of drinking water. ঠিক আছে, and it is consumed over 24 hours. After 24 hours, it is discarded. ঠিক আছে, these are available in sachet. Open the sachet and mix it up with 1 liter of drinking water. So why 1 liter? Because the osmolarity become 245. ঠিক আছে, what is the osmolarity of plasma? 290. So this is hypoosmolar. So there will be better absorption. Now in the old formula, you can see the osmolarity is about 310 higher. It was higher than the plasma osmolarity. So the WHO has done come up with a new formula so that osmolarity will be lower than the plasma osmolarity. Acha, osmolarity of individual components are also asked. ঠিক আছে, for sodium it is 75, for glucose it is 75. All right, so you can see that osmolarity of sodium and glucose is 1:1. ঠিক আছে, now why this? Why this 1:1 ratio is maintained? Now from your knowledge of biochemistry, you know that glucose and sodium are absorbed together by this SGLT co-transporter. Alright, so one glucose and one sodium are transported together. So the ratio of sodium to the molar ratio of sodium to glucose is 1:1. ঠিক আছে, পরীক্ষায় দেয় রোল অফ গ্লুকোজ ইন ওআরএস, সব নিউট্রিশন দিয়ে অনেক কিছু হাবিজাবি লিখে থাকে। ঠিক আছে, why is glucose used? Absorption of sodium, co-transportation of sodium, ঠিক আছে, and wherever sodium goes, water goes, ঠিক আছে, so that leads to rehydration. Role of glucose জিজ্ঞাসা করে, রোল অফ সোডিয়াম জিজ্ঞাসা করে, হাজিবাজি লিখে রাখা থাকে। ঠিক আছে, হাজিবাজি লিখবে না, সোজা কথা বলছি। আচ্ছা, so then chlorine is 65, then potassium is 20 and citrate is 10, so that adds up to 245. Acha, role of citrate is converted into bicarbonate that replenish the bicarbonate. ঠিক আছে, potassium, there is also loss of potassium, that is also replenished. ঠিক আছে, so individual role কিন্তু জিজ্ঞাসা করে, মানে লিখতে দেয়, কোশ্চেন আসে। রমি ঘুমাচ্ছে কেন আজকে, শরীর খারাপ? ঠান্ডা লাগছে? গরমের মধ্যে এসি চালিয়ে ঠান্ডা লাগছে? ঠিক আছে, so rationale of ORS, co-transportation of sodium and glucose, then it should be preferably hypotonic. Alright, molar ratio of glucose and sodium is equal, then enough potassium and bicarbonate or citrate compensate the loss. ঠিক আছে, এটা কিন্তু জিজ্ঞাসা করা হয়। ঠিক আছে, আর উত্তরে সবকিছু ভুলভাল পাই। Then we come to some other medications. Opioids. So what are opioids? In GI tract. Analgesic to অন্য জায়গায়, reduce motility and causes constipation. So we are concerned here about two receptors. One is the mu, other is the delta. So mu receptor causes decrease in motility and delta causes decrease in secretion. So both these receptors are useful in diarrhea. So a popular dish is posto. ঠিক আছে, what is posto? Poppy seeds, very tiny amount of opioids, helpful in diarrhea. ঠিক আছে, so let's come to the first medication, loperamide. It's an opioid agonist. ঠিক আছে, but it does not cross the blood-brain barrier. What is the advantage of not crossing the blood-brain barrier? So there will be no kicks. ঠিক আছে, no addictions. ঠিক আছে, it also does not produce any analgesia. It is exclusively used for diarrhea. ঠিক আছে, no analgesia, no addiction. But this medication is contraindicated in children. It causes toxic megacolon. কি বলছিস? It causes addiction হবে না বলছিস তো? Causes toxic megacolon. ঠিক আছে, diphenoxylate, these have abuse potential. ঠিক আছে, this is also an opioid agonist. ঠিক আছে, with no analgesic property more potent anti-diarrheal than morphine. ठीक है, has abuse potential combined with atropine. What is atropine? Muscarinic antagonist. ठीक है, muscarinic receptor antagonist. ठीक है, so what role can addiction কমায় আর না atropine, so atropine একটা তো বললো যে higher will prevent addiction, ঠিক আছে, হ্যাঁ secretion কমায়, ঠিক আছে, atropine cause dying down of secretion, lessen the secretion. In diarrhea there is excess of secretion, so that is being reduced by atropine. ঠিক আছে, lomotil combination of this diphenoxylate and atropine. আচ্ছা, Secretory, this is a relatively new drug. So what is enkephalin? Anyone? What is enkephalin? Anyone? No. So enkephalin is an endogenous opioid that is produced in the body. ঠিক আছে, that is being destroyed by an enzyme known as enkefalinase. So this Secretory prevents, inhibits this enkefalinase. So what happens? Amount of enkephalin in the body increases. ঠিক আছে, so enkephalin action mostly in the delta. ঠিক আছে, তাহলে কি হবে? It will lead to anti-secretory effect. ঠিক আছে, more than anti-motility effect. ঠিক আছে, আসে না এগুলো। So anticholinergic কি করবে? সিক্রিশন কমাবে, মোটিলিটি বাড়াবে, মোটিলিটি কমাবে, সিক্রিশন বাড়াবে, অ্যাবজর্পশন বাড়াবে, ঠিক আছে, সিক্রিশনও কমাবে, ঠিক আছে, মোটিলিটি কমাবে, অ্যাবজর্পশন বাড়াবে। তাহলে কি আছে? হাইসিনামাইড, ডাইসাইক্লোমিন। ডাইসাইক্লোমিন আর কোথায় কাজ করে? হোয়াট ইজ ডাইসাইক্লোমিন? তাই কেউ বলতে পারছে না কেন? আচ্ছা, তাহলে কি করবে? ডিক্রিজেস ক্যাম্প কম্বাইন্ড উইথ ওপিয়াইডস, ঠিক আছে। ডাইসাইক্লোমিন কি? হ্যাঁ, না, ডাইসাইক্লোমিনে অ্যান্টিকোলিনার্জিক অ্যাডভার্স এফেক্ট আছে। হিস্টামিন পড়ে নিল, হয়নি হিস্টামিন? ডাইসাইক্লোমিন বলতে পারছিস না? আচ্ছা, তাহলে mu2 agonist. So what is mu2 receptor? Alpha 2 receptor. What is alpha 2 receptor? Autoreceptor. হ্যাঁ, কি করে? ইনহিবিট করে, ঠিক আছে। লোকেটেড ইন প্রিসাইন্যাপটিক রিজিয়ন, লিডস টু ডিক্রিজ সিক্রিশন অফ নিউরোট্রান্সমিটার। অটোরিসেপ্টর, ঠিক আছে। এক্সাম্পল ক্লোনিডিন। সো ক্লোনিডিন কোথায় ইউজ করা? where have you? হাইপারটেনশন। আর কোথায়? আর কোথায়? স্মোকিং ছাড়ানোর জন্য, আর ওপিয়েড ডিঅ্যাডিকশনের জন্য, ঠিক আছে। সো ইট ফ্যাসিলিটেট অ্যাবজর্পশন, ইনহিবিট সিক্রেশন অফ ফ্লুইড অ্যান্ড ইলেকট্রোলাইট, ঠিক আছে। ইনক্রিজ ট্রানজিট টাইম, so where it is used, opioid withdrawal and diabetic diarrhea. Adverse reaction, there may be hypotension. Octreotide. So what is octreotide? Recombinant somatostatin. So what does somatostatin does? Inhibits secretion of all other hormones. ঠিক আছে, তাহলে কি হবে? Inhibits secretion of VIP, GH, insulin, glucagon, everything is inhibited. So what will happen to the motility? Decrease. ঠিক আছে, decrease motility, decrease intestinal fluid, electrolyte secretion, pancreatic secretion, gallbladder contraction, all of them are reduced. ঠিক আছে, so which type of diarrhea this octreotide is helpful? Secretory diarrhea. ঠিক আছে, this is helpful only in secretory diarrhea where there is excess of secretion. So subcutaneously used, helpful in secretory diarrhea. What are the adverse effects? Hypothyroidism, GB stone. GB stone কেন? মোটিলিটি কমে যাচ্ছে। ঠিক আছে, probiotics. So just now we have discussed about gut microbiomes. ঠিক আছে, so gut microbiomes may be destroyed during excess use of antibiotic. So in that case we have to replenish the gut microbiomes. So lactobacillus species, in which food we get lactobacillus species? Curd. ঠিক আছে, দই, yogurt. So এমনি naturally থাকে. So these are natural probiotic. Alright, then Bifidobacterium, Streptococcus fetalis, Enterococcus species, certain species of Enterococcus. Then Saccharomyces. What do you mean Saccharomyces? Fungus. ঠিক আছে, it's yeast. তুই বুঝছিস? তোর নাম কি? রঞ্জিনী। Zinc. Now zinc is the mechanism of action of zinc is unknown. Alright, in children it is used for less than 6 months, about 10 milligram per day for 14 days is used. For more than 6 months up to 5 years, 20 mg per day for 14 days. Now it has been observed that zinc causes early recovery and prevent extreme case of diarrhea. ঠিক আছে, now adsorbent, what do you mean by adsorption? So there is basically one substance surface adsorb another substance into the surface. So বলো bile absorber number resin. ঠিক আছে, ও যেটা বলছে resin. ঠিক আছে, so these are adsorbs the bacterial toxins. ঠিক আছে, these are probably banned in India. ঠিক আছে, kaolin, magnesium aluminum silicate, pectin. ঠিক আছে, they are probably banned in India, not used in India. ঠিক আছে, the idea is enterotoxin that is produced by bacteria will be adsorbed by these substances and will be passed down into the stool. Also pectin has a demulcent action. What do you mean by demulcent? So it forms a protective coating over the GI tract. Now we come to antimicrobials. Now not all diarrheas require antimicrobials. So if the diarrhea is caused by rotavirus, will antimicrobial be of any help? No. ঠিক আছে, no use in non-infectious cause. So what are the non-infectious cause? Irritable bowel syndrome. Irritable bowel syndrome may have infection, concurrent infection. If there is no infection, antimicrobial are of no use. ঠিক আছে, then celiac disease, pancreatic enzyme deficiency will lead to steatorrhea, ঠিক আছে, topical spool, what is topical spool? এই হয়নি, ঠিক আছে, thyrotoxicosis, what happens during thyrotoxicosis? So there is increase in thyroid hormone and increase in motility of the gut that leads to diarrhea. So we have to correct the level of thyroid hormone, ঠিক আছে, antimicrobial has no use. So case number 2, useful in severe disease. So in case the disease is not severe, you can maintain by rehydration therapy, all right, but when things get severe, you need to use antibiotics. So these are salmonella, invasive diarrhea. What are invasive organisms? Campylobacter. It's not a bacteria, it's a protozoa. Campylobacter, ঠিক আছে, enterotoxic E. coli, Shigella, Staph aureus, don't go into complication, ঠিক আছে, Shigella, ঠিক আছে, traveler's diarrhea, traveler's diarrhea caused by Campylobacter, ঠিক আছে, enterotoxic E. coli, they cause traveler's diarrhea, ঠিক আছে. Treatment of traveler's diarrhea. So rifaximin is used for treatment of traveler's diarrhea. So 400 mg TDS for thrice daily. Now rifaximin is not absorbed from the GI tract. Is it good or bad? Rifaximin is not absorbed from GI tract. Good, ঠিক আছে. So this rifaximin has to act in the gut, so I don't require it to be absorbed, I don't require it for systemic absorption, ঠিক আছে. Rifaximin is also used in hepatic encephalopathy. Have you heard this term, hepatic encephalopathy? বল কি, ঠিক আছে, there is liver failure, so there is detoxification of ammonia from the blood is hampered. So this rifaximin is used to kill the bacteria of the gut that produces ammonia, all right. So already there is excess of ammonia in the body and the gut bacteria are also producing ammonia, so that is stopped, ঠিক আছে. ADR, flatulence, bloating, abdominal pain, urgency of stool, what is this? আচ্ছা, bismuth subsalicylate, this is also used for traveler's diarrhea, ঠিক আছে. So what is the mechanism of action? Inhibit prostaglandin synthesis and chloride secretion, so mostly anti-secretory, also have some antibacterial action, ঠিক আছে. So antimicrobial action. So one of the chief complaints ADR of this bismuth subsalicylate is black stool, black tongue. In which condition do you get black stool? আচ্ছা, বিসমাথ তো এখানে দিচ্ছে, বিসমাথের জন্যই তো ব্ল্যাক স্টুল হচ্ছে, আর এনি pathogenic condition where there is black stool, so if there is altered blood in your stool, ঠিক আছে, জন্ডিসে তো হোয়াইট স্টুল হয়। ঠিক আছে, হিমাটিমেসিসে হিমাটিমেসিস বলছি, if there is melena there is black stool, altered blood in your stool appears to be black. So antimicrobial are always needed in cholera. ঠিক আছে, vibrio cholera, tetracycline is used, fluoroquinolones are used. ঠিক আছে, then campylobacter jejuni, fluoroquinolones are used. Clostridium difficile ওই মাত্র বললো what is used, I may তুই বল what is used in Clostridium difficile, একটু আগে ওই সিংহরায় বলেছি। Anyone? Metronidazole, ঠিক আছে, then amoebiasis, again metronidazole, giardiasis, again metronidazole, ঠিক আছে। ইউজ অফ metronidazole ওরালে জিজ্ঞাসা করে, ঠিক আছে, তো একটা বলেই লোকেরা চুপ হয়ে যায়। So there in your book you can find multiple use, please mention them, বুঝলি? So this is a prescription of anemic dysentery, not needed. Metronidazole 15 tablets, 1 tablet thrice daily for 5 days, 400 mg. Bacillary dysentery, ciprofloxacin 10 tablets, 1 tablet twice daily for 5 days. Now for the non-pharmacological protection or prevention, prevention is always better than cure. ঠিক আছে, তাহলে কি proper hygiene of food, proper sanitation, proper vaccination for rotavirus, শুধু rotavirus না, all the disease that is enlisted in your national immunization schedule. ঠিক আছে, vitamin A leads to পড়ে না, ঠিক আছে, হ্যান্ড ওয়াশিং কেন, হাইজিন, and if there is diarrhea, ORS, zinc, fluid. ঠিক আছে, any questions? তুই খুঁজে বার করবি কেন? So this is the mechanism of action of ORS. Sodium and glucose are being transported together, and along with it water goes along. ঠিক আছে,